Do you think these things will be a triggering factor for cancer in any way? Now, if a person is diagnosed with the cancer, so what is the first thing they should do and what are the treatment options for them?
I know from day one that this is not a cancer that I'm going to be able to cure.
But one simple question, is cancer curable? Hello everyone, I'm Dr. Talat Salim. Today we have with us Dr. Mohammad Zahran. He is a senior medical oncologist, Apollo Cancer Institute, Chennai. Assalamualaikum, Dr. Sir. So today we are here for the awareness of the cancer. 8th June is the World Tumor Day. We want to know the basic awareness, what a general public should know about the cancers. What is a cancer actually?
Okay, cancer is nothing but a condition where an abnormal cell grows and multiplies without any check and starts to spread and cause problems with the rest of the body. We all form abnormal cells every single day in our body, and there are some checks and balances in our body which mean that these cancer cells or these abnormal cells are damaged at that stage. When this mechanism fails for whatever reason, these cells can grow and multiply and spread and form tumors. So cancer is nothing but a tumor, but a malignant form of a tumor. There are two types of tumors, as you all know. One is a benign tumor, a tumor which usually does not spread, but the malignant tumor is the more aggressive form of the tumor where it spreads and causes problems. And what we see, what we hear about cancer and cancer patients succumbing to the illness is usually due to these aggressive tumors.
Okay, doctor. What are the main 5 types of cancers which are predominantly very common in the society nowadays?
5 main common cancers in India: breast cancer and cervical cancer in women, GI cancers, which is the stomach, colon, etc., lung cancers, and oral or head and neck cancers. These are the 5 most common cancers in India.
Doctor, we are surrounded by chemicals. If you see, they say even the pesticides, it has a carcinogenic agent. You take now agriculture, they spray all the pesticides. Again, we are loaded with that. When we use a detergent, it is again a cancerous thing. Radiations, it is a cancer. They say our lifestyle or anything, it's a triggering factor. How can we prevent ourselves? What should we do to help ourselves or save our family or everybody?
A lot of people ask this question. I don't think we all have answers to this. But what I have to say is a lot of these problems are man-made problems. A lot of these problems are problems that we have created for ourselves. Like you mentioned, pesticides, you mentioned radiation and so on. All this wasn't that much about 2 generations ago. We have surrounded ourselves with these problems. What I'm saying is there are things that we can do something about, and there are a lot of things that we really can't do much about. Things that we can do about, perhaps less exposure to radiation, so where possible to cut down the usage of mobile phones and the radiation that goes with this. When it comes to diet, we want to try and eat as healthy as we can, perhaps less canned food, less preserved food, and more of the natural food. I'm not trying to say that the vegetables and fruits that we get are very healthy nowadays, and I know there are problems there as well, but that's beyond us. So what we can do is to select good fresh quality fruit and vegetable and try and avoid preserved food, fast foods and so on, because that's the kind of risk that we can reduce. And one is the diet, but there's a lot to go with the exercise as well to try and stay fit, because more and more leading sedentary lifestyles, long days of work, a lot of travel, very little time for ourselves to maintain our health, physical fitness. So a lot of emphasis needs to be made on not only healthy eating, but trying to remain physically active and undertake some form of exercise.
Doctor, this is a common question. Usually they say we get organic foods where we don't have much of pesticide. Naturally, common people cannot afford it. But is there any edge if we use these organic foods? It may be reduce our exposure to the carcinogenic agents.
Yeah, I mean, if it is truly an organic food, they mean what they say on the box, and it is truly free of pesticides and things like that, then of course it would be good to have that. But unfortunately, the availability is a problem. The cost can be a problem. Anything that is labeled organic nowadays is generally a bit more expensive than the other food that we get. So where possible, if it is feasible, organic items, if they're truly organic, I think we should support that.
Okay. Doctor, sir, what are the common symptoms of
Okay.
cancer which we can pick up in the early stage?
So cancer symptoms can be quite non-specific. They can be quite vague a lot of the times. For example, in somebody with a lung cancer, we would expect them to either have a cough, some discomfort in their chest, or breathing difficulty. What we have to remember is just because you have a cough, it doesn't mean you have a cancer. Any symptom that is not sort of settling down on its own, if somebody had a cough, we would expect it to sort of settle down in about
within
4 weeks or 6 weeks.
something, yes.
But if it goes beyond that and you continue to take over-the-counter medication, go from doctor to doctor, clearly there is a problem. And somebody really needs to think back and say, why is this person coughing for such a long time? Could they have a cancer? So symptoms that don't go away, symptoms that last for a long time, and there's no clear explanation for that, they have to be investigated. There are more specific symptoms for cancers. For example, a lady with a breast lump,
Yeah.
although it may not always be a cancer, it could be a benign tumor, it could be a normal cyst, but anything that is to do with the breast, if it's a lump, nowadays we have got to exclude breast cancer.
Okay.
So we would highly advise those ladies to go and seek medical attention, to have an examination, and if necessary further tests to ensure that this is not a cancer, because we are seeing people with cancers where we are not expecting them to have cancers. Age is no longer a criteria.
For the cancer.
We see people in younger age groups coming with cancers, which surprises us.
Yes.
And some of these genetic cancers can present quite early on in life.
Yes.
So that's the key here. For a man, for example, if he has trouble passing urine, they're going more frequently at night time, their flow isn't as good, then it really warrants a consult with a neurologist. Again, not because they will have a cancer, but those symptoms certainly need investigation to exclude a cancer.
Earlier we were speaking and you were talking about the gastritis. This is a common thing what we see in our clinic.
Yeah.
Every second patient has gastritis, and you said that it has to resolve within 1 month or 2 months.
So generally,
Please tell me.
so common problem that we face, perhaps a lot of that could be diet related, it could be weight related, a lot of lifestyle issues causing. And generally, if it is a simple gastritis, it will settle down with over-the-counter medication. Being through different courses of medication, and it's going on for about 4 to 6 weeks. They're struggling to eat, always complaining of heartburn and so on. I think it warrants an examination. They would probably need to see a gastroenterologist, and almost certainly, if their age group is sort of more than 40 and so on, I'm not excluding the less than 40-year-olds, I think they would be offered an upper GI endoscopy, because unless you actually see the stomach with a camera, you can't assume that it is a normal gastritis and keep carrying on with over-the-counter medication. Yes.
Doctor, is there anything that if you have a genetic deposition already, you have a history, and triggering factors can accelerate the process, anything like that?
So if there is a strong family history of cancer, what we do nowadays in our practice is we would get them involved with a genetic counseling team. They may be offered some genetic tests to try and establish if they have a genetic problem. And if they do, we know that certain genetic problems can be associated with a variety of cancers. So we have to look out actively for these cancers with screening tests periodically through their life. So that is a risk that they cannot get rid of. Unless, of course, they have a specific gene called the BRCA1 or 2 gene, which is what we commonly see in women who have genetically induced breast cancers or ovarian cancers. They have the opportunity to have prophylactic or precautionary surgery, which could involve removal of both the breasts with reconstruction and removal of both the ovaries to try and reduce the risk of them from forming this cancer in the first place.
Yes.
And we've all heard of Angelina Jolie, the Hollywood actress, who carries such a gene, who's had these kind of operations done. And these are, at one point, they were thought of at perhaps not very gold standard options, but they are actually recommended options, and people carrying these genes are given the information to explore them.
Doctor, one thing here, we know that all this works, but as you know, most of the people are in denial. even if they have a genetic factor, they think it will not come to us. And there, one more fear is that there is a fear factor. See, carcinoma, cancer itself is a name which most of the people does not bring to their mouth also. I mean, I have seen so many people, they say that disease, they don't say cancer. That much is the fear of cancer inside them.
Yeah.
And then motivating a patient that you please go for screening when they don't have it. See, as a doctor, when patient comes in, we know 50% of it, what is the problem.
Yeah.
And like this patients, when they have, how do you diagnose them early and how do you convince them and what is the thing?
Yeah, so there's two things here.
Yeah.
One is ignorance is no longer bliss. Cancer is on the rise. No age group is spared, no gender is spared, and no class of society is spared. So we've got to remember that. And as I said earlier, if you've got any symptoms or any suspicion that you could be having a problem like this, it is better to get it checked early, because the earlier you check, the earlier you pick up a cancer, the more the chances of cure. Cancer is curable,
But early stage, early
it has to
intervention
be
is the
detected
key.
earlier, because we have a number of treatments that we can offer for cancer. When it comes to sort of solid cancers, which is what I specialize in, for example, the breast cancer and the lung and the ovarian cancer, GI cancers, for example, early stages, we can give them successful treatment, and you will only pick them up in early stages if they come to us with early symptoms, or if we pick them up with screening tests, which leads us on to what can we do to pick these people up early. For example, with women who are nearing 50, or in women who have a family history of breast cancer, perhaps much earlier than 50, we have to start doing mammograms, which is nothing but x-rays of both the breasts,
Yes.
to try and look out for these. Assuming that the mammogram is normal, we would recommend another mammogram every 3 years, but this process has to go on. It's when people don't adhere to these things, despite all the awareness that's there now. I understand that there is no national breast screening program as such in India right now compared to the West, but there is a lot of awareness going on, and women should be encouraged to take up mammograms once they're nearing 50. So we can pick these breast cancers up early, and if we pick them up early, the chances are that we can cure them. It's only when they come to us at a very late stage, a woman who has probably noticed a breast lump and yet has been, seeking alternative treatment, or not willing to have herself examined or go to a doctor, they are the ones who tend to get in trouble, because over the course of the months that they harbor this, it can grow and spread to other organs, and by the time they come to us, we know that we can perhaps treat and control their cancer and prolong their life, but a cure is going to be highly unlikely.
And doctor, just now you spoke about the breast cancer and the screening. That is, I feel, to some extent, there is little awareness about the mammogram and other things
Yeah.
and all. What about the other cancers? What are the other screening factors there, which actually other people should know that if we have these symptoms, we should go for this screening, and if anything, then we should reach to the doctor.
Yeah. So the thing is, the main screening test that has the most evidence behind it is mammogram.
Yeah.
For breast cancer screening.
Yes.
And in cases of elderly people, the fecal occult blood to check for colon cancers or lower GI tract cancers.
Okay.
But other cancers, for example, ovarian cancer, there is a certain blood test that we can do. But there have been studies that have been done looking at this blood test in a number of people. The results have been mixed, and therefore it has not become standard of care, so we don't start offering these blood tests to everybody. That said, I strongly feel once somebody in this day and age has turned about 40 or so, at least in the Indian setting where master health checkups are quite easily accessible, I think people should start doing their master health checks at least once a year. If not to pick up cancer, at least to pick up other health conditions like diabetes and hypertension, cardiac disease, and so on.
Okay. Do you think these things will be a triggering factor for cancer in any way? Lifestyle disorders or what we're talking about?
Some cancers can be related to lifestyle disorders, and things like uncontrolled sugar and so on may, in some cancers, prove to be something that accelerates the cancer and sort of helps it to grow and spread.
And now, if a person is diagnosed with the cancer, so what is the first thing they should do, and what are the treatment options for them?
So, I commonly see people who are being diagnosed with cancer. I'm not generally involved with people, but I'm actually diagnosing them. So when I have somebody who's come to me with a diagnosis of cancer, the first thing to ascertain is what stage it is and to know what my intention of treatment for them is going to be. And that's what sort of helps us decide how the treatment is going to run. If it is a cancer that is detected at an early stage, so let's take an example of a lady who's had a lump, who's picked it up very quickly, gone to the doctor, had a biopsy and come with the diagnosis of cancer. And I've done other investigations, the whole body checks, and ascertained that this is an early cancer. Normally, we would try and get them operated to take the breast cancer out with surgery. And when the full report comes out and the final stage is very clear, we think about what are the treatments we can use to minimize the risk of this cancer from coming back. So this is a lady who we are treating with the intention of curing her. And the treatments after surgery could include a combination of things, from chemotherapy to radiotherapy to some tablets called hormone treatments to drugs called targeted therapy. On the other hand, if we have a lady who has come to us with a stage 4 cancer, or in other words, a cancer that has started in the breast and spread to other organs, like, for example, the lungs, liver, bone, and so on, I know from day one that this is not a cancer that I'm going to be able to cure. We counsel them and the families accordingly. And we know from day one that the intention of treatment for this lady is going to be one of control and disease and to try and prolong their life as much as we can. And again, the options that we will have include chemotherapy, tablet treatments called hormone treatments, targeted therapy, and by necessity, radiotherapy. But these are treatments just to keep them keep the cancers under control, keep them comfortable, and to try and prolong their life. And with all the advancements that are happening in terms of medical oncology, the newer treatments that have been coming in, we are able to extend people's lives in quite a meaningful way and manage the side effects much better with all the new medications that come in. So that's what the situation is right now.
Doctor, with all what you were telling, the advances in the science and everything, I come to the understanding that you are telling to make the patient's life more comfortable, reduce the symptoms, prolong the lifespan. But one simple question, is cancer curable?
A one-word answer is yes.
Okay.
But there's a caveat to that. It has to be picked up early.
Okay. Early intervention is the key.
Early diagnosis and early intervention gives us a much better chances of curing somebody with cancer.
And what are the successful ways, or how can we, if a person is cured now and you tell them you're fine now, what care they should, after care they should take, and how follow-up they should do that it should not come back?
So every cancer survivor is given a program about how they should be followed up. Each cancer has a slightly different follow-up regimen, which could mean periodic physical checks, periodic scans, periodic blood tests, and so on. With years where the risk of recurrence is much higher. And as the years go by, the recurrence risk comes down. Unfortunately, it never goes down to zero. It still stays. But what you can do to try and stay active and minimize the risk as a cancer survivor is to watch your diet and undertake exercise, because these are the two things that have been proven time and time again to minimize the risk of recurrence: a good diet and good exercise.
Doctor, here you have put $1 billion question, diet. What do you mean by that? What is that diet which can help them to prolong or prevent the cancer? What is that actually?
Yeah, I mean, diet is a big, huge topic on its own, but to keep it very simple, what I mean is a very balanced diet between vegetables and fruits, less red meat, white meat where you can, less oily things, less preserved things, canned food, less or no sweets if you can possibly avoid, especially in cancer survivors, and fresh home cooked food with natural ingredients goes a long way.
Doctor, here you said sweets. When we see in a medical thing, even the rice what we take, it again goes into the body and it is again converted to the sugar.
So a balance between the carbohydrates.
So you mean to say that if we have the balance between carbohydrates and have more of fresh food and fresh vegetables and all, that will help us.
Absolutely it does. Absolutely it helps to I won't say prevent, but I would say reduce the risk of
Reduce the
recurrence.
risk
Yes.
of. Can you share any inspiring story? The patient which you have already seen and they have recovered and they're doing really well in life.
Yeah. So the one that comes readily to mind is a 16-year-old girl who's preparing for 12 board exams, presents with abdominal pain, which doesn't settle with normal medications. So she goes to the gynecologist. And lo and behold, she's diagnosed with ovarian cancer. Metastatic ovarian cancer. So she has
And it's
for that.
15,
16 years old with 2 or 3 weeks left for the board exam. A very bright girl.
Yeah.
So she's diagnosed with ovarian cancer, which is an early stage cancer. So she comes to see me, and as you can imagine, the family are completely broken.
Yeah.
And yet I had this very strong girl in front of me. It was a kind of ovarian cancer which needed chemotherapy quite eventually. But it was also, fortunately, a kind of ovarian cancer where we could give her a very high cure rate. And I still remember that her chemotherapy was going on, and she used to be in a chemotherapy ward preparing for her exams.
Oh my God.
So in fact, there were days when I would give her off so she could go and do the exams and come back. This was more than 3 years ago. So she, all being well, will be a chartered accountant next year.
Oh my God,
She
yeah.
just came to see me the other day, and every time she walks into my door, not only does it inspire me, but all of my team as well.
Yes. So there are the cases where the people have come out of cancer. It is not such a taboo how
Yeah.
it was earlier, but we cannot ignore the symptoms.
So cancer is not a death sentence.
Yes.
So I tell my people, it's not a death sentence, but just make sure that you take the advice of your doctor well and adhere to all the advice that's given. Stay positive and hope for the best.
Or for the best. And doctor, as we know, being a doctor, we know that body speaks to us. It speaks to us in this form of symptoms. As you said, you have gastritis, you have regular cough, you have other abdominal pain. Don't ignore these initial things. It may or may not be the thing which has to be picked up in the early stage. What you would like to say, because you have such a big practice and such a experience about these cases, what will be that thing you want to tell, a takeaway message for our viewers?
Sure. So the takeaway message is to say that cancers are curable as long as they are picked up early. Try and seek early medical attention. Eat a healthy diet. Undertake regular exercise. And if there's a family history of cancer, be aware of it and be under regular medical supervision. And just know that if you or anybody else in your family were to be diagnosed with a cancer, it is not a death sentence. There are a lot of emerging treatments. Of course, some of them are curative and some of them aren't. But we are able to prolong people's lives as much as we can, much more than we've ever been able to do, and to try and provide people the best quality of life that is possible.
I really thank you, doctor, for your time and your advice. Trust me, these are the real things which can change someone's life, and it will be useful for all of us. Really appreciate your support.
Thank you. Thank you so much. Thank you.